Hello, I'm Dr. Madhu Prashanth. I'm a senior consultant interventional radiologist in Bangalore, Sakra World Hospital. I've been practicing intervention for over 15 years now, and let us share some experiences with few products from Merrill. See, diabetic food, I think now everybody knows India is a pandemic of diabetic diseases, and diabetic food diseases are a huge health burden, and the life expectancy in diabetic food far lesser than many onco cancer cases also. So revascularization not only saves the limb but also saves the productivity of the person as such. So it makes a very big difference to the patient. So there are many options with diabetic food. One is other than surgically amputating the limb. Most commonly we use plain balloons without any stents or without any drug coated technologies, but recently a lot of drug coated technologies are available where the long term patency of the vessel is far well improved, and that's what makes the foot ulcer heal faster. And especially with scaffolds, which are bio-absorbable material, the problem of keeping a foreign body in the vessel is solved. So over a period of time the scaffolds are absorbed, and the need for long-term surveillance of a foreign body like a stent is reduced. So definitely scaffolds make a big difference, and hopefully we may get even larger diameter scaffolds for other above the knee lesions also. So I hope it will make the life of the patient and the treating physician. So for SFA lesions, which are larger diameter vessels, around 5 to 6 mm or lesions, for short segment lesions generally balloon angioplasty works extremely well, and whenever we do large vessel recanalization like SFA, the chances of ulcer healing or the limb reflow is extremely increased compared to small vessel recanalizations. And there are many situations where there are dissections, where there are very long segment occlusions. In these scenarios, stents do make a big difference. Stents like Promesa, and there are many other stents also which are vessel mimicking stents. So they definitely make a big difference in two things. One is in the initial patency and chance of not having a immediate occlusion or recoil, that is the primary patency, and also in terms of long-term patencies. So long-term patencies of stents are very comparable to stents plus drug-coated balloons, if at all we are having the luxury of choosing both together in any patient. But definitely they make a big difference in terms of the limb revascularization and no compromise flow through the vessel. So that's my take on stents. So there are multiple options, stent options for SFA. One option, promising option, is definitely Promesa stent, which I think we used a lot of stents over a period of last 3 years or something since it has been available, and the immediate post-procedure response and long-term patency also has been very good, at least in my experience. Hopefully 5-year experiences data, what the literature shows may be comparable with what we have also, but at least my experience with Promesa is maybe for last 3 or 4 years. So definitely it has been extremely good. We have not had any obvious complications or long-term issues. So that's a promising thing.